Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic doctor. Oh my god, that's my... Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic doctor in London. Do you know how many emails I get every week from patients who have had something injected, like Botox or fillers, something like that, and they are like totally freaking out because they've got a bruise? Yeah, it's quite a lot. It's quite a lot. And of course, yeah, we always have that conversation. You might bruise, there is a risk that this could happen. We are sticking a needle into your face after all. You don't really know where all the blood vessels are, or the little ones anyway. So there is a risk that you could get a bruise. You need to prepare yourself for that eventuality. So what do we do if somebody does get a bruise and you can either see it coming, like when you've done the treatment, you just see like it's starting to form underneath the surface of the skin, or if it shows up even like maybe 2 or 3 days later, is there any hope for these people? Well, first of all, I would say, number one, don't panic, because it's normal. If you jabbed yourself in the thigh with a needle, you might get a bruise as well. So don't be surprised if there's some bruising after you've had a treatment. And don't make the mistake either of kind of saying, oh, well, you know, when I had it with such and such 3 years ago, I didn't get a bruise. Because, do you know what? So what? The anatomy, you don't know where it is. Such and such was lucky last time they treated you. Maybe this time you're unlucky. So it's not necessarily an indicator of skill on the part of the injector whether or not you bruise. Obviously, if you're seeing like the Butcher of Blackwall and they're like, you know, hacking away and jimmying around like this and, you know, really going for it, of course, yeah, you are more likely to get bruising and swelling after that happens. But, you know, if you're being injected by somebody, you can see that they're being careful, you know, that they're using all the right size needles and, you know, they're being respectful of the tissues, and then you get a bruise, then I am sorry, but it is just bad luck. It's just one of those things. How long does a bruise last? Well, kind of depends on you. So, for example, if you're kind of fit and healthy and you're, you know, sort of youngish, probably about 10 days if it's something significant. And you'll see it go through that normal bruise cycle where it goes dark, like a purple colour, possibly even like a blacky purple colour, and then you'll see it goes a bit greeny and then yellow and then slowly starts to fade. So what can you do to try and speed up that purple, black, green, yellow cycle? I'm going to take you through my favourite things that you can do at home afterwards. So, first up is the old Arnica versus Bromelaine debate. I know a lot of people like Arnica. I'm more of a Bromelaine girl. The reason for that is it's got more evidence behind it. So in a review study done recently, they found that 5 out of 7 clinical papers had found a positive effect of Bromelaine, and 4 out of 13 found a positive effect for Arnica. So the figures are better for the Bromelaine. That's oral, by the way, not topical. So this is the one that I like to use. It's Higher Nature Bromelaine. It's a pineapple enzyme. It's very good for taking down swelling as well. So if you're feeling a bit puffy after you've had treatment done, maybe you're thinking you might get a bruise or two, start knocking down the Bromelaine. It can't hurt you. And you take one of these 3 times a day. Works a treat. If you want to take it alongside Arnica, then totally be my guest. Go for it. Knock yourself out. Speaking of Arnica, I do have one Arnica cream in the clinic, which is this Teoxane post-procedure fluid. I say fluid. It's basically a cream. It just says fluid on the front, I think, to make it sound a bit fancy. And the reason that I like this one is it contains arnica and a bit of aloe vera, but also some chlorhexidine as well, which is an antiseptic. So it's quite good if, you know, when you've had a treatment done and you need to do a little bit of massage to sort of, you know, mold the product gently into place. Well, I tend to do it with this. Although not always. Sometimes I do it with this. But yeah, this is definitely something which is more clinic based. You probably could use it at home, but by the time that you've gone home, you probably don't really need to use anything with chlorhexidine in it. This one, Auriga Auriderm XO. This is vitamin K cream. So there's not as much evidence for vitamin K cream, but there was one study looking at people who have had laser treatment and whether or not use of topical vitamin K could speed up the bruising after the laser treatment, and the answer was yes, it could. Again, sometimes I will use this in the clinic, but this is probably more appropriate for you to use at home as well. It's cheap as chips. You can just buy it on the internet. It's by a company called Auriga International. Last up, we've got Bruise MD Cream. It pretty much does what it says on the label. So it's for prevention and treatment of bruising. So with this one, it's quite interesting because if you see a bruise forming, you just run on over to the cupboard, whip out the Bruise MD cream and slather that on there, because the glycerol inside the product makes the capillaries close off a little bit because it causes a tiny bit of swelling there. You have to wait until the treatment has finished before you use that, because otherwise you can't really see, you know, what you're doing, and is that swelling caused by the cream, or like what is it, who knows. But basically it stops the flow of blood being quite as much to that area, thus reducing the bruising. So you can also use it once a bruise has formed as well, should you wish to. Though, to be fair, I would probably, if you're going to do it at home, I'd probably use the oral Bromelaine and the vitamin K cream, I think, to, you know, really pack that sort of double punch there. What if you want to be like totally extra about this? Like topicals, it's not enough for you. Taking a tablet is not enough. You need to push it to the next level. What do you do then? Well, my friends, you have laser or IPL. So sometimes if somebody has an event coming up and it's like a super important thing, we'll have them come back to the clinic and use some laser on them. Normally, if it's a purple or a black bruise, then we'll go with the ND YAG laser. If it's kind of going like greeny yellow, IPL works better for that. But you can also use a KTP laser as well, and a pulse dye laser too. It just happens that they're the ones that we have in the clinic. And in my experience, if you're treating when the bruise is at the purple or black stage, you'll probably cut that healing time in half roughly. I'm sure there are some things out there for bruising that I haven't mentioned yet. I'm just talking about the products that I tend to use in the clinic. If you have got any amazing tips or tricks for bruising up your sleeve, then please let me know. I haven't talked about people who use garlic or any vitamin E supplements or any anticoagulants or anything like that, because, you know, if you're taking an oral medication to stop your blood from clotting, it's kind of important. You kind of need to keep taking that. You definitely wouldn't stop taking that just because you're going to have a cosmetic procedure. Even if you're taking warfarin, you can still have injectables done. So don't be worried about that. I'd rather that you bled a little bit than had a stroke. So yeah, guys, if you've got any tips that I haven't mentioned, let me know in that comment section below. We're going to start doing a bit of a feature at the end of these Wednesday videos now, where you ask me a question and send in a picture of yourself saying, should I get this, this or this done? Or, you know, what do I suggest or something like that. So If you want to be on one of the videos and ask me a question like that and you don't mind being like roasted a little bit, then drop me an email. I'd love to hear from you. Okay guys, so that's it for this week. I hope you enjoyed it and found it illuminating. Please join me again next week where I will be talking about more of the same stuff. And I promise next week, 100% for sure, that video of me reacting to celeb fillers and other work, it will be out. It will be out. I just haven't quite nailed it yet. Okay, so I'll see you then. Ta-ra!